UT Physicians would like to welcome you to our patient self-assessment video series, where today we will be reviewing the knee. To begin this assessment, please find a hallway or room in your home where you can take 5 consecutive steps. At a natural pace, please walk forwards and backwards and report any difficulty you may find to your healthcare provider. The next part of the assessment involves locating the specific part of the knee that is most painful. Please begin by sitting with your knee fully extended and relaxed as shown. Start by finding the top of your kneecap with your fingers. Then, follow around your entire kneecap with your fingers as shown in this video. Make sure at either end you push firmly, or if you find any areas of pain, please explore that in more detail. Once you've made it all the way around, put your fingers on either side of your kneecap and gently push from side to side. Please note any pain, clicking, or differences from your other knee. Now, push and hold your kneecap each direction for several seconds. Please note if either direction feels more uncomfortable than the other. Now, we will feel around the edges of the knee joint. Find the base of your kneecap and drop down an inch or so as shown in the video. Then, follow your fingers around to the inside edge of the knee. Next, go back to the same starting point and follow around the outside edge. Lastly, use both hands to feel behind the knee along the skin fold. Please note any pain, swelling, or bruising you may find. The next part of the video will assess how well you can straighten and lift your knee. Start by sitting upright with your foot propped up as shown. Try to actively straighten your knee by flexing your quadricep muscle, which is the muscle on the front of your thigh as shown in the video. Now, while actively squeezing your quadricep muscle, try to lift your foot straight up in the air as shown. Now, let your leg relax with the foot propped up. Once in this position, press downwards with your hands just above your kneecap and hold for several seconds. Compare how straight your injured knee is with your non-injured knee and report differences to your healthcare provider. This part of the video will assess how well you can bend your knee. Start by sitting in a chair with feet resting comfortably below you. Slowly extend your knee several times from the resting position and take special note of any pain, popping, clicking, or difficulty you may feel. Next, fully bend your knee as much as you can. Once it is bent fully, gently use your hands to apply extra pressure as shown. Be sure not to push through any pain while performing this test. This next part of the video will assess the strength of your muscles. Start by sitting upright on the edge of a chair as shown. Place your non-injured foot in front of your injured foot. Push into the heel of your non-injured foot as shown. Next, slightly extend your injured leg, placing your heel into the ground as shown. Pull your heel into the ground, but make sure not to let your heel slide. This part of the video will assess some of the ligaments that help support your knee. Start by sitting on the edge of a chair with your knees bent to 90 degrees. Let your injured knee fall outwards, keeping your foot in the same spot on the ground. If this motion feels okay, gently add some pressure with your hand as shown in the video. Next, do the same thing with your knee falling inwards. Report any differences you notice between your injured and non-injured knee. The last part of the video will assess your functional performance. Start by standing and facing the back of a chair, using the chair for balance. Make sure your knees are as straight as possible. Then, go up onto your toes to perform a calf raise, repeating several times. Next, step away from the chair and stand with feet shoulder width apart. Slowly shift your weight to one side and lift the opposite leg off the ground. Try to hold this position without losing your balance for 10 seconds, and then perform the same test on the other leg. Now, step back to your chair and put your hands on it for balance. Stand on one leg fully extended and rotate your body several times in both directions. Next, slightly bend your knee and again rotate your body several times in both directions. Lastly, step away from the chair and stand with feet slightly wider than shoulder width. Without letting your heels come off the ground, perform a squat as shown in the video. Repeat this several times, stopping if you have pain or difficulty. This completes the knee self-assessment. Thank you for your participation and allowing us to be a part of your healthcare journey. The testing you performed will help your healthcare provider determine an accurate diagnosis and prescribe appropriate treatment to get you feeling better as quickly as possible.